Remember, the job of the kidneys is to filter the blood, and as they do so, we get rid of the waste products. So because the kidneys have such a massive job filtering all that blood, regulating blood volume, regulating the composition and the pH of the blood, they receive about 20 to 25% of cardiac output. Now that blood is going to come in through the renal arteries, and the blood flow through the kidneys is called renal blood flow, and it's about 1.2 liters every minute. Now think about that, 1.2 liters per minute. You've got somewhere between 4 to 6 liters of blood, so that means on average, every 5 minutes, all your blood flows through and is filtered through the kidneys. So before we look at the pathway of getting blood into the kidneys, let's do just a brief overview of the parts of the nephron, because we're going to look at it pretty intensely on the next slide. So I want you first to look at this upper image right here. Okay, so this yellow structure is one nephron that's going to empty into a collecting duct. So your nephron starts right here with this yellow ball. Okay, that yellow ball then is going to empty into this long, kinky tubular structure here. Okay, so all of that is a nephron. It's in that ball that blood is going to be filtered. So blood comes in and it's filtered across a little capillary bed inside the ball. That little capillary bed, all tangled up there inside the ball, is called the glomerulus. Now the filtrate is going to stay in that little ball structure and then go through the tube, and eventually it's either going to be resorbed or it goes to the toilet. The blood continues its normal pathway, so it's going to come in, get filtered in the glomerulus or across the walls of that little capillary bed called the glomerulus, and then the cleaned up blood goes back out. Now when that blood goes back out, there's a little network of blood vessels right here called peritubular capillaries. What does peri mean? Around. That's right. So around the tubule, peritubular, you have a network of capillaries. That network of capillaries allows us to resorb water, sodium, other electrolytes, and things that are filtered out in the urine, or what would be urine, but we want to keep it. So remember when we talked about how ADH poked holes in the kidney filter units so that water leaks out? Well, it's these peritubular capillaries that soak that water back up. Remember when we talked about aldosterone and how aldosterone causes sodium-potassium pumps to be built in the walls of the kidney filter unit? That's the nephron. So when sodium is pumped out of the nephron, water follows it. What happens? These peritubular capillaries soak it right back up. So all that goes back into the blood, not into the toilet. All right, so that's our overview of the nephron. So let's look at how this blood flow comes into and back out of the kidneys. So we begin by bringing blood in through the renal artery. Your renal artery is going to branch into segmental arteries that go to different segments of the kidneys. Your segmental arteries are going to give rise to interlobar or lobar arteries in the lobes. Okay, so the pyramids and part of the columns are the lobes. So segmental arteries give rise to interlobar arteries. Your interlobar arteries are going to give rise to arcuate arteries. They form an arc. Okay, they're found right there at the broad base of the pyramids. Okay, so they're at the border between the medulla and the cortex. Your arcuate arteries are then going to give rise to teeny tiny little cortical radiate arteries. Remember, this is the cortex. These little arteries radiate out to the cortex. All right, in the cortex, your cortical radiate arteries are going to send blood into an afferent arteriole. What do you know about afferent? A for admit, right? So your we'll look here at the nephron again. The afferent arteriole brings blood into the glomerulus. Now, filtration happens right here across the walls of these glomerular capillaries. The filtrate stays in the ball structure. The cleaned up blood goes out the efferent, E for exit, arteriole. Now, that efferent arteriole is going to give rise to these peritubular capillaries, where we're going to resorb what we're getting out of the nephron that we want to keep in the body. We filter out way more filtrate than we urinate out because we reclaim substances as they leave the walls of the nephron, and those peritubular capillaries reclaim them. So your peritubular capillaries are then all going to merge together, and when they do so, they're going to reunite and form cortical radiate veins. So emptying right back into, here you can see one, a cortical radiate vein. So your cortical radiate veins are going to be the little veins out here in the cortex that are going to empty into arcuate veins. Okay, there you can see the arcuate veins. Your arcuate veins are going to empty into interlobar veins that are going to empty into segmental veins that are going to empty into the renal vein. Nothing new there. Well, maybe a few terms, but we still take blood out through arteries, into arterioles, into capillaries, and then into venules, and then into larger and larger veins, and the renal vein dumps that blood back into the vena cava. The renal nerves are part of the sympathetic division of the autonomic nervous system. So most of them are going to be vasomotor nerves, vasomotor, vessels, action, right? And these are going to regulate the flow of blood through the kidneys by vasodilation or vasoconstriction of the renal arterioles. The nephrons are the functional units of the kidney, and each nephron consists of two parts, a renal corpuscle, where the blood's going to be filtered, and the renal tubule, where the filtrate passes. So the two components of the renal corpuscle are the glomerulus, that network of blood vessels we just talked about, and the capsule that contains it, okay? So all of this is renal corpuscle. So you're going to have afferent arterioles bringing blood into the capillaries, the glomerular capillaries, so all of this is the glomerulus, and then an efferent arteriole taking that blood out. Now the filtrate stays in the container, the capsule, okay? It's the glomerular capsule, sometimes also called Bowman's capsule. That filtrate then passes from the capsule into the nephron loop. So the nephron loop, the renal tubule has a proximal convoluted tubule. Convoluted simply means that it's twisted up or tightly coiled. It's not straight. So the filtrate passes through the proximal, closest to the point of attachment, convoluted tubule. That then becomes the nephron loop, also called the loop of Henle, Henle. Nephron loop is the more correct term. So proximal convoluted tubule becomes the descending limb of the loop of Henle, which then makes a U-turn and becomes the ascending limb of the loop of Henle, and then the distal convoluted tubule. So the distal convoluted tubule of several nephrons are going to empty into a collecting duct. So the distal convoluted tubule would have a collecting duct over here that it empties into, and several nephrons would empty into that collecting duct. So your collecting ducts are then all going to merge together and empty into larger papillary ducts. The papillary ducts are then going to empty into the minor calyx, which merge to form major calyces, which all merge to form the renal pelvis that exits the kidney to become the ureter that fills the bladder. Exactly, that's emptied by the urethra. I knew you knew it already. About 80 to 85% of our nephrons are what we call cortical nephrons. Anytime you see cortical, remember that's referring to cortex. So your cortical nephrons have their renal corpuscle in the outer part of the renal cortex. So here you see the renal corpuscle. This is the cortex. This is the medulla. There's the papillae. So the renal corpuscle's in the outer part of the cortex, and they have a somewhat short nephron loop that just goes into the outer part of the medulla. So these nephrons are going to create urine that's similar in its osmolarity or its composition of solutes compared to the blood. The second type of nephrons are juxta glomerular. Okay, so that makes up about 15 to 20% of the nephrons. Juxta means near to, medullary, the medulla. So you can see that the renal corpuscles are going to be within the cortex, but then there's a very long nephron loop that extends very deep down into the deepest areas of the medulla. So these juxtamedullary nephrons that have that long loop can either create a very dilute urine or a very concentrated urine, as more or less water and ions are going to be maintained or retained in the body and absorbed back into the blood, or more or less water and ions excreted through the filtrate.